Hello and welcome to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. And today we have a very special guest, Cindy Lai, the AVP of Marketing and Communications of the CAIPA organization. Cindy, thank you so much for taking time to chat with us today. Please tell us a little bit about yourself and the organization.
Hey, good morning. Thank you for inviting me to participate in this podcast. So my name is Cindy Lai, and I'm the AVP of Marketing and Communication at CAIPA. CAIPA stands for Coalition of Asian American Independent Physician Association. It's a mouthful. CAIPA is the largest and the most successful independent physician association in Metro New York area. We serve over 500,000 Asian population and with over 70 specialties in the network. So we have been in practice for over 20 years and we continue to grow. We contracted with many different health plans, labs, and with hospital as well. So we have a pretty impressive network serving the community.
Yeah, so tell me more the value of a provider who joins the coalition. What is the value to them?
So basically the idea is instead of individual provider to go contract with health plans to get the patient, we help them to do the contract negotiation. We also take a lot of the administrative burden away from the provider so that they can focus and invest all the times in the patient. Our provider will be able to deliver the top quality instead of spending all the time on the claims, on the paperwork. One of my main role is to provide the education and training program for our provider. Our doctor continue need to be refreshed and trained and educated, especially dealing with government, program, health insurance program. There just continue to be, many update changes, policy, so on and so forth.
So does your organization act as a management company for some of these practices? Are you doing operational support or marketing support?
I think it's everything. Besides what I talk about negotiating the contract, right? We continue to provide compliance information to our provider to make sure the practice are in compliance, whether it's government program or commercial program. We do a lot of outreach program as well to make sure that we outreach to the patient and educate the community. So in addition, we have a VBP payment, meaning value-based payment program. What does it mean is there are stringent requirement by the government, by the state Department of Health that we need to reach. And in order to reach those requirements, we will be able to save the money for the government while delivering the quality care to our patient.
Wow, so all the providers are part of a value-based care program when they're part of your coalition?
Very much. Obviously, it's up to them to enroll or not. Yeah, but most of our provider, we have really high standard for a provider. And, working with health plan on this VBP payment program.
Yeah, value-based care is a very interesting topic, and it seems to be where the health insurances are envisioning the ways of getting the cost of healthcare lowered and the compensation for providers increased by containing the overall cost to prevent chronic disease in patients. Is that correct?
Absolutely. Because don't forget is in order to do that, right? Now there is risk as well. If we are not able to reach the goal that's set up by the state, working with the health plan, we might incur risk, meaning cost.
Sure.
But so far, of course, we CAIPA is very confident, and that's why we are able to make this VBP contract with a number of health plans. So it is a gold standard in terms of quality care and in terms of managing our patient because on one hand, we have to reach the very stringent standard measures On the other hand, we have to be very careful looking at the cost of utilization.
Sure. Yeah. The only way you can confidently go into a value-based care program is if you have the full confidence in your team and your providers to be able to deliver the high quality care before the conditions become exacerbated and become, I guess you're trying to capture and prevent conditions and provide treatments up front before they become more serious.
And that's exactly about our preventive care come into place. So as an organization, we look into every aspect of our patient population, and the need continue to change and evolve based on the environment. For example, right now we live in the COVID. So as an organization, how are we going to adapt to the changes, increasing different needs of our patient? So that's, again, another big role of being an IPA.
Since you mentioned the value-based care program, it's something that's a very intriguing topic for a lot of our listeners on the podcast. A lot of providers are hearing the benefits, but then there's also risks with value-based care. When you said you're contracting with the state, it would also be correct that you're doing value-based care programs with the private insurers, the Blue Cross Blue Shields of the world. Is that correct?
Correct. Exactly. That's actually how it come into place. We have several major health plan partners. And in terms of the number of membership, those are the health partners that we work with because they have confidence in us in delivering the top quality care to the member, meaning our patient.
Talk to me about how it works as far as, let's say, telemedicine. You want to help your providers introduce telemedicine to their patients. How are you rolling out some of these technologies such as telemedicine to improve the speed and efficiency of care delivered to patients?
So telemedicine service and program have existed years prior to pandemic. It's not new. It's just that the pandemic, it kind of like, kind of pressing the need for doing more often and expanded to a wider group of patient population. So, but advancement in technology and the overall healthcare along with COVID-19 cases have contributed to a surge in telemedicine adoption. Now, convenient and beneficial telemedicine, which is a kind of like remote patient care and treatment, in another word, right, has already become a tool for monitoring existing patients, but at the same time attracting new patients while proving itself to be the future of the healthcare industry.
Yeah, I mean, like you said, it's an ecosystem that you're building that includes new technologies, telemedicine, and traditional interventions with PCP and other specialists that is really putting together the perfect synergistic delivery of healthcare.
Exactly. And then one of the very important thing, this is culturally, linguistically tailored for the Chinese American patient in the New York City. I think that distinguishes ourselves from many other programs.
I can imagine, the amount of information that's out there is great, but now you have to convert it all to content and copy that can actually be absorbed by a lot of your patients that might not be fluent in English.
Exactly. And even like we do a lot of training for our provider before we launch this program. So we are very prepared. When I say culturally and linguistically, means that from the staff who pick up the phone to the nurse, to the educator, to the coach, to the doctor, not to mention, right? They are all capable of, in the language, Mandarin, Cantonese, or sometimes Shanghainese, right? In order to take the good care of our patient. So just like any other workplace, right, healthcare organization or hospitals, his institution have their own way of running. And culture is very much tied to that, the way they operate, the way they run the organization. So part of the organization culture is share values, practice, and purpose. They are all working towards one mission, one goal, whether it's delivering quality care or improving the health of patient population. So to promote a positive, a healthy culture is also about relationship and of building and ensuring everyone in the organization has a sense of belonging within that community.
I mean, you're a coalition with over 1,000 private practices that are part of the organization. Is that correct? And how many providers did you say?
Over 1,200.
Over 1,200 providers. So, how are you helping to maintain a certain level of culture and philosophy of treating patients when you have so many practitioners and practices that are part of the organization? It's not like you are delivering a culture for one health system. You're dealing with 1,000 different businesses essentially that all have their own independent teams. How do you help such a massive organization that are kind of going to the beat of their own drum?
Great question. And the answer is communication, 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 and communication. We are not an enterprise. Our provider have their own tax ID. Okay, so they're running. In another word, they are running their own business. They could hire 10 nurses or 2 nurses or whatever, right? So that's the business. What as an IPA, our mission is to unite them all together, sharing one mission, one goal, and also the different, quality measure that we set up either by the health plan or by the department, by DOH. So communication is really the key in terms of delivering the right message and the right goal to our provider.
Sure. And I imagine one of the benefits of joining the coalition is the internal referrals of patients from one specialty to another. I'm sure they all potentially stay within the group.
Correct.
When they have to go out to see other specialists.
Correct. Exactly. So we have another, again, very smooth, efficient referral system. That's another great thing in terms of helping putting the patient in the right hand.
Tell me, in your opinion, what is the most pressing issues facing health systems going into 2023?
So we are starting to see a more noticeable digital shift, especially with the increased use of telemedicine and telehealth services at the peak of pandemic. Those who have not already incorporated the virtual engagement as part of the healthcare system may risk losing patients. However, with technology advancement, more time we have to spend training provider and patient who may have difficulty documenting or adopting this way of monitoring. Another concern that need to be addressed is the mental health care access. I'm here like every day, the mental health issue is becoming the number one most pressing issue in the overall healthcare system. People every day are living with some sort of mental illness, and global viral outbreak have only led to the increase in depression and anxiety cases. More than half of US adults are left untreated, totaling to at least 27 million. Now, access is so limited due to a number of reasons: financial reason, racial barrier, social stigma, or due to the lack of professional because of provider shortage. During COVID, we have been continue recruiting behavior and mental health provider. We never have enough. And I'm sure that, all other healthcare organizations share the same issue. So health inequality is going to be ongoing problem that could become costly for our U.S. healthcare system.
Yeah, I couldn't agree with you more. I think the shortage of mental health professionals is a real problem, and just the lack of care that is being delivered to patients who have mental health issues. I think there's plenty of studies that show poor mental health can lead to chronic diseases, and there is a correlation between unhealthy thoughts and overwhelming anxiety, which then triggers the body to not fight disease properly or to not digest and break down chemicals and vitamins properly and nutrients properly. It's kind of like a domino effect, and it starts with your mental health. And once that goes in a bad direction, the body kind of follows after it.
Exactly. The physical and mental, they are interrelated.
Yes.
It has to be treated. And so there's always saying that you have to, the overall health and wellness. So we start seeing, and our doctor is also like, seeing that when we treat a patient, it's the overall wellness, not just for a single part. And that is something that we continue to educate, to train, our provider on this aspect, because it's costly. It's really costly to our, overall healthcare system.
I couldn't agree more. And I think the approach of treating the body as a whole is very important. And it doesn't get looked in depth enough as treating a patient as the whole body and the holistic approach when you're a single specialty. But when you have all these providers that are a part of a coalition with every specialty across the board that are all communicating and referring, the patients have a much better chance of getting that holistic approach. So, I can see why you guys are doing such an excellent job at closing that gap in patient care and catching patients that are on the onset of very serious issues and illnesses by all these programs that you're delivering to your partner providers and the patients that you serve.
Well, now you kind of help to put everything together and see how everything tie in, like from technology, POC, telemedicine, to I talk about so much about quality, about provider education and training, and the staff who are culturally and linguistically trained. Doesn't it kind of like you see the whole picture? And why we say we are the best and the most successful. We don't say it easily, but you kind of like see how this organization work and our extended arms family working with the hospital, make sure that, to minimize the readmission of the hospital.
Sure. And I am confident to say that you earn the right to say that you are one of the best, if not the best, coalitions out there for providers, and you are making a big impact and difference for the patient populations that you serve.
Thank you so much. There's still a lot of work to do. Every day is a new day when it comes to healthcare.
Well, Cindy, thank you so much for sharing all these amazing insights and experiences and information about your organization. We really enjoyed having you on the show today.
Thank you so much for inviting me to participate. We'll be more than happy to, any way that we can contribute in the future.
Yeah, I really enjoyed our conversation. I know there's a lot more we can talk about. We're both passionate about healthcare.
For 24 hours for days.
Yeah, I think we'll have to have you. We'll have to have you back on the show again soon.
Okay, thank you. I would love to.
Awesome. I will circle back with you, Cindy, and you have a wonderful day. Thanks again.
And if you have any question, feel free to email to me. I'll be more than happy to help. Thank you. You have a good day.
Take care.
Okay, bye-bye.